Hey sis,
Hiya.
welcome to Cafe Soul Pod. We've got Auntie Karen in the house and it's been our birthday week. Grand old age of
60.
3 times 20. How was your birthday?
It was good. I
Do
was
you-
at work, but it was good. I enjoyed it. I got loads of birthday wishes, lots of lovely birthday presents, and seeing people and stuff like that. So yeah, it's all been good.
Do you feel older?
No.
Do you feel wiser?
No, definitely.
And did you ever get your abscess in your mouth sorted? Did you ever get to see a dentist?
I didn't. No. Luckily, like most people, I'm not daft, and I kind of, remember all your self-care and me sure brushing them, rinsing them,
I was telling people you were mouth washing all the time
mouth
after you were
washing
eating.
and things like that. Obviously being aware of what to have softer foods to eat on the opposite side of my mouth, stuff like that. And it did towards the end of the week. I mean, it was a Monday morning when I got up when my face was all swollen. So by obviously Wednesday night, Thursday, it started going down a bit. And then by the weekend, it had totally gone. I was lucky, which I didn't have a great deal of pain from the offset, which not everybody is that lucky, because I mean they are quite painful. Anything to do with your teeth, aren't they? But no, nothing. I'm not with a dentist because I had missed appointments, and it was just after COVID when my dentist informed me that I had been taken off their books.
That happened to a lot of people after
It
COVID.
did.
You haven't turned up, you haven't been for
did.
appointments for this long.
Yeah.
It took you off the register. Well,
But yeah, we've been out for what, 3-4
Yeah.
months of COVID or whatever. And
well,
then
it took a long
still-
time for the world to get back, really.
Yeah, it took a long time after that. So yeah, I think we were a bit unfair then. Unless you pay,
Yeah, go private.
and you can go to any dentist, and that they'll state that they are an NHS dentist, but
They're not taking NHS patients.
they're not taking patients on unless you're willing to pay, and that's just for what do you call it? Just a general look in your mouth to see
Yeah.
if anything needs to do, like checkups and stuff like that. So you have to pay.
Well, I looked up on Google. You cannot formally register for an NHS dentist like you do with a GP because the right to permanent dental registration was removed in 2006. Instead of being paid to keep patients on a permanent list, NHS dentists are contracted for limited treatment capacity, causing severe shortages and widespread difficulty in securing appointments. The 2006 NHS dental contract, no permanent lists. The system switched to paying dentists per unit of dental activity rather than per registered patient. And that was, dentists were running at a loss
Right.
because that unit of dental activity, the payment they were getting, is not taking into account the treatment the patient was getting
Right.
and the time and everything and all that stuff. I
Sick.
feel for the dentists, I've got to tell you.
Yeah.
So, end of obligation. Dentists have no long-term duty to see you once a specific course of treatment finishes. Informal lists, any recurrent checkup lists a practice keeps is just a courtesy, not a legal guarantee of care.
Right.
Why appointments are missing? Unpopular contract. Many dentists reduced or stopped doing NHS work because they find the funding model unappealing. They cannot manage on it. Practices hold fixed limits on how much NHS work they can do, leaving no room to take on new patients. And the high demand, millions of people, like 50% of the UK, can't get registered with an NHS dentist. That's bad. Millions of people try to find care, but limited funding means very few spaces open up. What can you do? Search widely. Use the NHS Find a Dentist tool to check for any nearby practices that might take patients or add you on a waiting list. Contact your ICB. If local surgeries turn you away, reach out to your local integrated care board, which manages NHS dental services in your area. To get urgent help, and we're going to talk about this in a minute, if you're in severe pain, bleeding or have an infection, you're advised to call the NHS 111 to access urgent emergency dental care. Over to Karen, who did this very thing.
I did this. It was recommended to me to do by my GP, and I went home. I rang NHS 111. I was given 2 phone numbers for local dentists for urgent care. I had to answer a few questions first, and I maybe should have answered yes to a couple of these. So anyone listening to this, if you have an abscess or an infection and you ring 111, if they ask you if it hurts when you clench your teeth together, please say yes. Because I said no, because I didn't. I was being truthful. So end of help. 2 phone numbers, which were very local to me. Rang them up. No appointments at all for urgent care. Now, urgent to me was
It's urgent.
different. Yeah, it's urgent. You need to be seen now. No urgent care services anywhere.
And I'll just interject here. I had a FaceTime call with Karen, and a face where this abscess was in the jaw, the side of her face was up like a pudding, and her neck was up like, because your neck went right down your neck, didn't it? That was up like a pudding. So that was the condition, and people see now it.
Yeah.
So tell us.
Well, I couldn't get an appointment, and I went up to the A&E again, suggested by the GP, who had examined me that morning and saw that it was an abscess, told us it was an abscess, but also told us that they couldn't give me any antibiotics in case they give us the wrong kind and it hid anything or underlying. So took GP's advice, went up to A&E to be met by one of the receptionists who went, well, we're not a dentist. And the other receptionist went, well, you wouldn't call a plumber for an electrical fault, would you?
And that was goddamn rude.
That was awful. And I actually
considering she's in front of the people, face to face, and they could absolutely see the condition of her face and her neck.
And I was quite polite, actually, and I turned around and I said, well, of course you wouldn't, but when your GP gives you advice, tells you
to do the very thing you're doing,
you know, you take their advice and you do, especially for what it is in your mouth, graceful, but no help.
So not only no help, but some woman, I'm not going to call her a lady, on reception at the hospital tried to make her look stupid. Yeah. You wouldn't call a plumber out to do an electrical work. But our GP had literally advised her to go to that very place. Yeah. So that, very unprofessional. And if she'd be out of a job. She would be out of a job, because that's not customer care, it's not customer focused, and it's not respectful at all to the person that's coming towards you.
Well, I think in that kind of state, you're just trying to focus on getting some help from somewhere, because you know in your head you've got to get rid of this before you hopefully get to see a dentist. Because I've been told, when I've told people this, they've gone, did you not report her? I would have reported her. And I went, in that moment, that didn't enter my head. Well, you're more
concerned about your abscess.
Yeah. Because this was only it was only within a couple of hours of me waking up like that in the morning. And bear in mind, obviously, I have osteoarthritis. 6 buses I was on within the course of 4 hours, and then on phones and stuff like that, trying to get some
And this
help.
This is a lady, right? I'm going to tell you, she's just turned 60 this week, like we said. From a motorbike accident she had when she was 16, that affects her today. She has a stick. She had a heart attack just a few years back.
Coming up 3, yeah.
And she's been led down a flipping no-end path, really. Yeah. 6 different buses trying to go in different places, trying to get help for this abscess. And being spoken to like that from receptionists in the hospital is absolutely appalling. How many of the people are suffering like this? It's crazy. But we did get some feedback off our community. And if I go and quickly and have a look here, where was with dentists? One of our community says that's why I went and had mine done in Turkey. She had 3 infections caused by bad dentistry in the UK and was then told she was lucky she hadn't got sepsis.
Wow.
And I mean, that can happen with the bloody abscess and stuff as well if it gets out of hand and
Because I
treated
wondered
and
where the
infected.
infection had gone.
So, another community member said, my tooth is cracked. I had a dentist and due to COVID, they chucked me off to not being for appointments, even though we weren't allowed. Was an NHS one. Now the waiting list is about 2 years. So, again, that's another example of someone
It is.
through the COVID.
One of the dentists I rang for urgent care basically said because they weren't taking on new patients, they couldn't give me an appointment for urgent care because I would need follow-up treatment.
I mean, it says in that thing, it's like they've got no follow-on care duties to you.
No. I mean, I explained what happened, that I'd been to the GP. The GP had said, yes, it isn't a dental abscess. So I knew what was going on. All I said, and I said, all I need really is
So what it was antibiotics.
some antibiotics to get rid of the infection for the abscess to go down.
And do you know what this can lead to?
No help anyway.
This could have led Karen to online purchases. This could have led Karen to going online and typing into Google antibiotics for an abscess.
I did.
Did you?
Yeah.
She could have bought those. And
Oh.
sometimes you're buying things, you don't know what you're fucking buying, and that could have...
A box of
Been-
amoxicillin. It was over £30
Wow.
for a box of amoxicillin.
But the fear is, that's what people are doing. You cannot get
Yeah.
seen by a GP sometimes even,
Yeah.
or a dentist. They're trying to treat themselves. So we do. We go and look. How can we... That's a risky thing. That's a risky thing, isn't it?
How many people since COVID, and we've read about it, yes, not so much now, but have pulled their own teeth out with pliers because they can't get to see a dentist. I mean, that's bad. Like, say, sepsis. Our mum died of sepsis in hospital. So it is a killer. And just no help whatsoever. Ring back. Or if you ring back at 9 o'clock in the morning for an urgent care, if we get a cancellation, we may be able to fit you in. We weren't interested. And also the dental hospital, you can't even ring them now. You have to send them an email. They read the emails between 8 a.m. and 4:30 p.m. on Monday or Friday. They will ring you the following day, but they will only ring once. If you don't answer, that's you off. You have to email again.
Oh my God. So really, you don't even know when they're going to be reading your email.
Nope.
So you've got no idea when that call's going to come in. You're going to have to be like glued to your phone.
Well, that's it.
If you're working, that's a difficult thing to be.
If it comes up private number, unknown number, I don't answer them.
There's a lot of
because
people
most
don't.
of them are scams and stuff like that, or wanting to sell you insurances and things, so I don't answer. So
That's horrendous, that. But I mean,
Yeah.
how many emails did they get? And who's going through all these emails and contacting the people back?
Exactly.
I mean, what do we think, folks? What do we think? That's ridiculous. But Karen, you had a few comments on your page.
I did it, but
on
it was
your
basically,
post on Facebook.
I was just one had said that she couldn't get with her dentist, but was lucky enough to get a dentist nearer for urgent care, which is not far from where I live. I had no such joy, but I think she said this was last
And does she
year.
think she's registered with that?
She thinks she's registered with
Nobody's,
the one.
and we've just read nobody, since
Yeah.
2006, nobody's registered. It's a courtesy.
Well,
So it's not
yeah.
like I've got a dentist.
but with her own dentist, as she put it, she would have had to wait 6 weeks. But because it was urgent, she ended up getting an appointment at one not too far away. Another, she said, her friend had to go to A&E and get treatment there. I don't know which A&E. I don't know if it was the same one as me. but they don't have a dental hospital there, but they have a maxillofacial place who deals with anything to do with the face, the head, who could have prescribed antibiotics. And even my nurse told me that you cannot get past a receptionist, because the receptionist is saying, no, we don't have this, or no, we can't provide this, or no, and they're not giving you any information to go forward, then you're stuck. And I know there's a lot of good, helpful receptionists out there, and doctors, and
but just in any walk of life and in any profession, you're going to get the odds.
You have the other ones who are quite jobs with, and then
well, some of them are jobs works, and some of them are just not doing that job.
They're not,
and they're not. They shouldn't be in the care field.
Yeah, they're not helping you, because being a reception in a care environment, you're still in the care field. You know.
But do we think? Do you know? Anything that happens to the body, we'll go to hospital.
Yeah.
They don't turn us away.
No.
They don't say to us, we've got any beds, can I come in?
No.
So do we not think that the dental care should also be part of what we pay in the NHS and be part of the hospital where nobody's turned a fucking way?
I mean, I'm not being funny, sis. I could have easily have gone back to A&E. I could have gone home. I could have rang 999 and said I was having chest pains. And followed, yes, I've done this, and yes, I've done that, took my spray and stuff like that, and been wasting time for an ambulance to come out for me, to take me to the hospital, to investigate this, and by seeing the doctor, he would see me face. Do you know what I mean? But to me, that would be me wasting NHS resources.
It's just ridiculous. Something needs to be done. So what do you think about it? What is your experience with the NHS? Let us know. cafesoulpod@gmail.com. Bye for now.
Bye.